In Alameda County, we have a vision of health equity. We envision an Alameda County where
everyone,
no matter who you are,
where you live,
how much money you make,
or the color of your skin,
has equal opportunity to lead a healthy, fulfilling, and productive life.
health is about more than just health care. Health happens when people have access to the broad range of daily goods and services they need to be healthy.
To support good health in our neighborhoods, we need access to good quality food, we need housing that's affordable, we need some community support, and we need community involvement.
Also having access to green space and other community gathering spaces where people can build relationships but also have the space to develop themselves as full human beings. Those are both key to individual health and also the health of the broader community.
I think the most important resources that people need in their neighborhoods to support good health are employment, stable housing, and access to good physical and mental health care and support services.
And I feel that if they talk to a therapist or a psychologist, they'll be able to get some type of guidance or find a way to cope with these issues.
When you teach young people to live healthy as young people, they continue that into their adult lives. They also aren't exposed to a lot of the diseases that a lot of minorities have later on in life.
If all people had access to the resources, opportunities, and support they need to be healthy, this is what health equity could look like across Alameda County. Every resident in the county would be able to live and thrive well into their later years of life. Today, the unfair reality is that all people in Alameda County do not have an equal chance at living a long, healthy life. Good health is not spread throughout, and ill health is concentrated in certain places. If we zoom into Oakland, we can see how just a few miles can greatly impact life chances. And if we take into account place and race, we see even greater differences in life chances. Compared to a white child born in the affluent Oakland Hills, an African American child born in East Oakland can expect to live 15 fewer years.
I think the biggest barriers to good health in high poverty neighborhoods are unemployment, lack of access to quality education, both of which lead to high rates of violence and incarceration.
People are worried about their public safety. What happens in East Oakland, there's a lot of homicides. And not only the people that die are affected, but also their loved ones and the surroundings. The community itself, it creates a stressful environment, which also kills us. It's a mental and a physical harm that most people don't see or realize, but it's there and it's in our communities.
In my neighborhood, I believe the biggest barrier to good health is the lack of access to quality food. We're in a food desert, there's not a whole lot of organic choices, no real farmers market that offer a plethora of food. We need quality food to have good health.
Well, one of the biggest barriers to health in high poverty neighborhoods really has to do with just the lack of attention and overall kind of neglect. High poverty areas are usually the areas where they kind of criminalize poverty, and that's a huge problem. Poverty shouldn't be criminalized. We should really be looking at addressing the root causes of poverty.
Health inequities and unequal neighborhood conditions did not just happen overnight. They have been powerfully shaped by history. In the United States, we have a long history of intentional public policies and private practices that have led to high concentrations of people of color and poverty in certain places.
If you take East Oakland, here in Alameda County, you have the U.S. Highway Administration using eminent domain to build one of the freeways, one of many in America that cut right through vibrant Black communities. You have the attachment of deeds with covenants that say you can't sell to Black people can't own in this community. You've got redlining where you can't get a loan. You've got predatory lending so that people who live in poor communities actually pay more for credit. And so what we're doing now is paying a price for some very poor practices. Some practices where we've structured racialization, where we've given people inequitable access to opportunity.
Patterns of racial segregation and concentrated poverty persist in Alameda County. Where 1 in 15 white residents live in high poverty neighborhoods compared to 1 in 9 Asians, 1 in 5 Pacific Islanders and Native Americans, 1 in 4 Latinos, and 1 in 3 Blacks. People of color continue to be more likely to live in high-poverty neighborhoods with barriers to good health. With each step up in neighborhood poverty, life expectancy goes down. Higher poverty neighborhoods often have fewer resources to support good health and greater exposure to health risks. Alameda County Public Health Department is working across multiple sectors and partnering in non-traditional ways in order to address the unequal conditions that matter for health. Here are examples of the problems we're tackling and the solutions we're advancing in partnership with others. Residents of high-poverty neighborhoods have over 2 times less household income than people in affluent neighborhoods.
The financial difficulties and challenges we face in this community are all interrelated. Very few job opportunities, low entrepreneurship, education is very poor, healthcare is expensive, and the housing crisis is really a crisis. We're being bought out and can't afford to stay in our homes. The Castlemont Community Market creates an opportunity for people in the area to learn how to be a business person. Alameda County Health Department and Best Baby Zone come together and create a framework where you can come and sell your goods as well as learn the ropes of how to start a small business here in Oakland. And we need that in our community.
Residents of high-poverty neighborhoods are almost 2 times as likely to be severely burdened by housing rental costs than people in affluent areas.
Rising rental costs and housing costs overall really impact people's well-being, because a lot of times people are making trade-offs between what they can pay for when their rents go up. So that might mean not buying, healthier foods. It might mean not buying medicine for some people. It might mean not doing other things in your life that actually are really good for your health, because people don't have access to the resources to do it. Also, in Oakland, with a lot of new larger landlords who are coming in and charging higher rents, what we're seeing is a lot of intimidation. And so a lot of tenants who are being harassed, and that's having an impact on people's mental health especially, but can also have an impact on people's physical health as well. There's also a correlation between rising rents and people living in unhealthy conditions. So people are either paying low rents to stay in properties that are not well maintained, and that's having an impact on their health, or we see overcrowding, where you have a lot of people who are living in a space, and that can also have impact on individual and community health. One critical outcome that has come out of the work we've done with the Alameda County Public Health Department is that we've really been able to shift the debate around how people talk about issues of housing, and really being able to make that connection to health has really shifted the way that decision makers engage us. And no decision maker wants to say that they're against health. They're not going to say they're against public health or against community health or individual health. And so having that framework is incredibly important and has been a key part of our strategy to pass policy.
Residents of high-poverty neighborhoods face nearly 8 times higher rates of homicide than people in affluent neighborhoods.
I think violence affects young people to an extreme degree. Every part of their existence, from their motivation to do well, even just down to how they live their lives. And I think that it's a big problem that needs to be addressed and is slowly being addressed through the Ashland Reach Center. Reach Ashland came to be through a group of young people who were tired of the conditions that they were experiencing. They reached out to Supervisor Nate Miley along with the Alameda County Public Health Department, and it was quickly realized that a youth center was needed in the community to provide a resource for young people, and that the young people could have a place to call their own. It gives young people a place to go, and they're not on the streets, and they are able to utilize resources and to be involved in activities that they maybe have never been able to get involved with, and it gives them a sense of empowerment.
Residents of high-poverty neighborhoods are nearly 5 times more likely to be locked up as a youth for nonviolent offenses than people in affluent areas.
There are a few things that lead to mass incarceration in low-income communities and communities of color. One is disproportionate minority contact at every stage of the judicial process. So from stop and frisk and racial profiling all the way up through arrests and incarceration. The other factor is over-policing and harsh discipline at the school level. And so this is more suspensions, more expulsions, and other factors that result in kids being pushed out of school, which has an impact on mass incarceration for young folks of color. And finally, it's the lack of access to resources that are so important for healthy communities. So the same things that we were talking about before, unemployment, lack of access to high quality education, lack of stable housing, all of those are disproportionately represented in low income communities and impact and influence mass incarceration. The Mentoring Center's Transformative Leadership Institute, funded by Alameda County's Innovations in Reentry Grant, helps young formerly incarcerated folks in two critical ways. The first is access to support services and health resources. The second way is through our Transformative Leadership Institute, which supports leadership development and mentoring. These things are critical because they really support young people's decision-making skills and critical thinking skills, which really support healthier relationship with their peers, their families, and with their communities. This supports young people's healthy and successful reentry back into their communities, which lowers their recidivism.
We each have a role in achieving health equity. Those were a few examples of how our health department is actively engaging impacted communities and fighting to change the unequal conditions that matter for health. We collectively must take action to improve everyone's health.
Join us in our efforts to become an Alameda County where everyone, no matter who you are, where you live, how much money you make, or the color of your skin, has the opportunities to lead a healthy, fulfilling, and productive life.